on the streets often means dying on them. People who are unhoused live half as long as the general population. It might sound obvious, but you can't be healthy without a home. And healthcare workers know that firsthand. They're often discharging people right back onto the streets. But now, doctors in Toronto are trying to change that by providing housing as a critical form of treatment. So is this prescribing housing as a form of healthcare?
Yeah, given the dire situation that people are in.
Dr. Andrew Buzari is a primary care physician and renowned expert in social medicine. He's leading the push to house the most vulnerable.
The data is very clear. People who are unhoused live half as long. The rates of chronic disease, of cancer, are 2 to 3 to 5-fold higher. We are physically imposing death and suffering on individuals by failing to provide housing as a human right.
51 supportive housing units with access to medical care will go up here on a former hospital parking lot this summer. The project, believed to be a Canadian first, will establish housing as part of Toronto's University Health Network, a partnership with the city and community groups, backed by provincial and federal funding.
You can't just sit back.
Buzari says it's about treating a glaring need.
We cannot look away now and say, well, we're not aware. We were not really aware of the connection between housing and health. We can't disconnect the hospital bed crisis, the healthcare crisis, from the homelessness crisis. And these are some tangible and concrete steps to try to address housing, but we know this has to be done at a level that's scalable, with more partnerships with every level of government, and most importantly, listening to what communities have been calling for a very long time.
It's a small step towards confronting a devastating crisis.
Graydon Lee passed away on February 28th, and Perry Corbier on March 29th.
Homelessness kills 2 to 3 people in Toronto every week. A monthly memorial service recognizes those who keep dying on city streets and shelters. It's at once a recognition of their lives and an exhausted reprimand.
When you're screaming into the void, trying to get more support for our community, and nobody responds, the government doesn't respond, it's really heartbreaking.
Roxanne Danielson is a nurse at Inner City Family Health Team.
When you see clients coming in here, how often do you think what a difference a home could make?
Oh, I think it all the time. If somebody is homeless, my first thought from a health perspective is that they need housing. Sorry, my hands are a little bit cold.
Roman Cheveluk is one of her longtime patients.
So many of my people are dead, right? That's the reality of it, eh?
Cheveluk spent decades battling addiction and living in and out of shelters before finally accessing social housing.
How important was housing for your recovery?
Very important. I feel secure. I just stress the importance of being able to lock your door.
Would it have been possible to get healthy without your own place?
Oh, heck no. You go to an NA meeting, but you're walking by all these people smoking rock and that, right? You get what I mean? So what happens? You can go in there with the best intention, but you can get ground down by that system, right? I've seen it happen to too many people. Now I got it all back, but it took me a lot of years. I had the blessing of the housing to build upon, right?
The fact that Cheveluk's success is extraordinary speaks to the staggering lack of supportive and affordable housing in Toronto. There are about 80,000 people on a waiting list. The majority will wait for at least a decade, and shelters are turning away 100 to 200 people every night.
Has it gotten worse in the last little while?
Definitely. Definitely since when I started working as a street nurse in 2014 until now, the amount of homeless people in Toronto has greatly increased. And with the rate of inflation, people just can't keep up with their wages. And so we are seeing more of middle class becoming homeless because they're just not making enough money to survive and to pay rent.
So you're dealing with people who've never had to live on the streets before?
Absolutely.
Housing as a form of social medicine may seem like an obvious remedy, but experts say it demands a collective sense of responsibility and, above all, action.
There are remedies for this. We just have to pull together, and every level of government needs to see that if we don't act, the numbers are very real as to how much hurt and suffering and death. And the question is, how much are we willing as a society to endure?
So, Ioanna, it seems to make sense from a healthcare perspective. What about cost?
Well, the moral argument is clear, David, and so is the math. Dr. Bouzari says it costs about $2,500 a month to offer someone supportive housing. That same person staying in the hospital for a month can cost the system up to $20,000. We know people living on the streets are much sicker, and this type of housing can also help reduce repeat visits to emergency rooms.
Is this being looked at anywhere else in the country?
In a more temporary way, Alberta Health Services has teamed up with a community group in Edmonton, and they've created 36 transitional beds, 12 of which are now in operation. And the goal there is, like I said, more temporary. It's to offer people a safe place to heal, people who are experiencing homelessness and who are being discharged from emergency rooms, and then to find them more permanent housing.
All right. Ioanna Roumeliotis, thanks very much.
You're welcome.